education for elementary students. We have full faith in our superintendents, our school leaders, and our teachers as they make plans to determine what's best for their students and for their families and for their staff to get students back into school buildings. We understand the disruption and the stress that it creates to go back and forth between individual and virtual education. And St. Louis County will be available to work with our school partners to make this as smooth as possible. As a result of our current data, the Department of Public Health is not currently recommending a transition to in-person learning for middle school and high school students. We'll work with our partners to protect and support these students and plan for their eventual transition back to in-person learning as soon as the data supports it. It is our shared goal to get there safely. Additionally, our data currently supports increased participation for some youth sports activities. We are currently, today, amending our youth sports guidelines for St. Louis County and adding a third classification of sports, moderate frequency contact sports. And our amendments are now aligned with recommendations from the St. Louis Sports Medicine COVID-19 Task Force and most of the recommendations from the state of Illinois. However, at this time, we will not allow the resumption of high-frequency contact athletic activities such as games, tournaments, and other competitions, or moderate frequency contact sports at the high school level. In line with our current recommendations regarding younger children, we think that there are some additional opportunities for younger children to engage in a wide variety of sports, including games and competitions within the region, again, for low and moderate contact sports. And all ages will be able to participate in low contact sports activities. All of the activities that our youth over 14 are participating in, not just sports, have the ability to increase COVID transmission among students and then subsequently back to their families. We know that all of these recommendations affect school sports fall seasons. Neither the St. Louis County guidelines nor the COVID Sports Medicine Task Force currently recommend competition games for high school students. The new guidelines from St. Louis County will make the distinction to allow sports competition for activities under age 14. We also know that the Missouri High School Athletics Association has given schools until September 17th to determine if they will take the option to move their fall school sports seasons to the spring. We are not mandating the St. Louis County schools move their season, but we also recommend how difficult it will be to put together games and competitions later this fall if the COVID transmission improves to the point where we could consider recommending competition and tournaments at the high school level of high contact sports. If schools choose to not move their season, they will still be required to follow the St. Louis County Youth Sports Guidelines and cannot engage in competitions at the high school level for limited sports until they are changed based on the number of cases of COVID infection among our high school students. This recommendation does provide schools with the opportunity to plan for ways to engage their students in a full season of play of activities at a later date. So even if the rate of transmission decreases enough to potentially allow for other youth sports to resume this fall, schools may struggle to plan a full season of play. And this decision, of course, is not a unique one. We've seen many colleges move their fall sports to a spring season. Many conferences have done the same. For details on our recommendations for youth sports, you can look on our webpage, stlcorona.com, where they are now published. I'll be glad to answer any questions.
Dr.
Page,
what do you say to families who obviously have kids participating, many of whom have kids participating in these fall sports that can't go forward now? What's your message to them about why this decision was made for sports like football and soccer and volleyball? What's, in your mind, the key element for people to understand about why you did this?
Well, I think first we have to understand that that this pandemic has been tragic to many people in our community, including all the activities surrounding sports. That the responsibility of our Department of Public Health is to keep kids safe. And we see a rate of transmission in all activities that teenagers participate in, especially 15, 19-year-olds, including sports. And these recommendations are coming forward based on what's best to protect the health and welfare of teenagers who are currently having a rate of COVID transmission that is not acceptable. It puts them at risk and it puts their families at risk. These activities that transmit infections are yet not unique to school sports, but school sports remain an area of high concern.
Dr. Page, today Los Angeles announced restrictions on Halloween. Keeping in mind the data that you just shared as far as transmission rates among the youngest kids, do you foresee Halloween going on close to normal, or are you considering restrictions for Halloween trick-or-treating activities?
Well, Halloween is 6 or 7 weeks away, so we'll see where we are when that time comes. But I think most parents will be cautious about what they expose their kids to, what they let them touch, really for the rest of the fall. But our Department of Public Health hasn't proposed any restrictions other than the ones that are commonly available, including mask wearing, frequent hand washing, and social distancing. Some of that will be difficult to do around traditional trick-or-treating activities, but we understand this is an important holiday, and we'll look for a way to celebrate it safely.
I want to go back to the sports for a second. Originally, earlier this summer, when you announced restrictions on so many sports, you said it wasn't the sports themselves that were the issue, it was crowds gathering to watch. It sounds like as we still have restrictions on more high contact sports, there is suggestion that it's the sport themselves, the football players coming into close contact with each other. So both within teams and also for spectators, have contact tracers been able to prove cases coming from those events, or is that more anecdotal?
Well, I think we have to recognize that any time folks gather in crowds, work closely together with heavy breathing, without masks, that there is going to be transmission. Our contact tracers have associated some cases with gatherings around high school sports and some sporting activities, but no one is here to say that high school sports have caused this pandemic or the sole cause of transmission in our community. That high school sports remains an at-risk opportunity for kids to gather and to spread infection, especially if there's a high infection rate among that population. And currently, in the 15 to 19-year-old age group, the positivity rate is 20%. It's too high.
What's the timeline, Doctor, for readdressing this? Are all of the fall sports now gone, or is there a way that they might come back at some point? I know you kind of alluded to it. It might be difficult to start that back up, but what's your thought timeline-wise going forward?
Yeah, well, we'll continue to look at positivity rates, but the schools have until September 17th to decide if they want to try and pursue fall sports season or to reserve the right to have that sport play in the spring under the Missouri High School Athletic Association guidelines and all of their criteria and rules and regulations. So if high schools want to try and pursue a partial season and put together games that determines on how many teams they have to compete with in the region, and whether or not they want to try and take a chance that we might be in a better place with COVID, where we might allow some competitions. We're not ready to make that decision. We can't predict where COVID's going to be in 2 or 3 or 4 weeks to say whether or not we would allow competitions of high contact sports. That doesn't seem to be likely right now. And so schools who want to try and preserve a season, preserve practices, preserve that right under the high school rules for the state, maybe dealing with a partial season, or maybe dealing with an inability to have competitions. We just can't guarantee that it would be safe to do that right now.
Do you feel like most of these schools, or would your advice be to most of these schools to reschedule for the spring, or do you have a feeling that some schools might opt to try and play games outside of St. Louis County, like in St. Charles or Jefferson, where they're hosting football games?
Yeah, well, I think that our demographics are different in St. Louis County. Our COVID penetration among high school students may be a little different. rules and regulations may be a little different, but we're always going to focus on keeping people safe. I think that it will be difficult to gather a full team of high school students that want to take risks if the Department of Public Health determines it's not safe. But schools have to make those determinations, whether or not they want to take a chance at a partial season. Or I haven't heard any schools talking about playing outside of St. Louis County. It's certainly difficult for their students and difficult for their fans. But we're going to continue to focus on decisions that protect the health and welfare of people in St. Louis County, and we follow the guidelines of our public health officials and our medical community.
So at this point, you would advise schools to reschedule for the spring?
Yeah, the Department of Public Health has advised that moderate and high frequency contact sports, that schools seriously consider moving those seasons to the spring, as the Missouri State High School Athletics Association has given them that option to do so. That gives them the opportunity of a full season of play, and a season now would be partial at best and limited with other schools who would be interested in participating in competition. So it would be an abbreviated season and a season with limited competitors as it stands now, with the potential of not being able to play in competitions of these high contact sports because of the risk of transmission among students in St. Louis County, among teenagers. Again, there's nothing unique to high school sports other than it is one activity that is certainly associated with transmission of COVID among a group that has a 20% positivity rate right now.
But you have no definitive data linking like high school football, or high school soccer, or high school volleyball to the spread of COVID. It's just that age group.
The age group is high risk. The activities we know are high risk. It is obvious to us that gathering people together, we do have some transmission associated with these activities, but we know that gathering people together in activities where there is heavy breathing in close contacts without being able to follow our social distancing guidelines by the nature and the design of these sporting events puts people at risk.
Dr. Page, do you know off the top of your head, as far as symptoms go in that younger age group between 15 and 19 compared to other age groups, are these cases, as far as hospitalizations, are they asymptomatic? Are they quite ill? How does it compare?
Yeah,
to other
I don't
groups?
have, I'm sure that data is available about how symptoms present 15 and 19-year-olds. I can't report it to you now, maybe our health department can. But we know that in general, younger kids aren't as sick. There is certainly a lot of discussion about how they don't get that sick, and it's not that big of a deal. We went through that a few weeks ago, that a false narrative that kids don't get sick, or a false narrative that it's not important that they don't get very sick. But it is important that kids get sick. It is important that the rate of transmission is high, and it is important that they move it around in the community as carriers and take it back to their families. And we have to make these tough decisions to limit the spread of COVID in our community so we don't get to the place that we've seen in other places of the country where we're required to have more closure to protect the life and safety and health and welfare of everyone in the community.
Did you say 15 and 19-year-old in general a 20% positivity rate, or specifically in St. Louis County?
Well, that's specific to St. Louis County.
15 and 19-year-old, 20% positivity rate right now. And that prompted this move.
That is one of our fundamental factors in the decision that the public health department is making.
And that's compared to what's the general positivity rate?
7% on average, less than 6% among 5 to 9-year-olds.
10% on average for the other age groups?
7.5% on average across the community.
Okay.
And that number is updated weekly on the stlchronic.com webpage.
You said 6% for 5 to 9?
I have a
Okay,
question
Chuck.
from Mrs. Scotch. Can spectators attend indoor hockey games at places like Centene Ice, Rink, or other indoor facilities?
Those are limited by capacity, and I would refer that question to our Department of Public Health for specifics.
Okay.
But those events are limited by capacity, and events like that, I do believe, require permitting process, or at least approval by the Department of Public Health. We're talking about fans and spectators at indoor events, like ice hockey. Ice hockey is a high-contact sport, so of course it's limited in its ability for competitions, but they are allowing practices and scrimmages.
Also from our health department, in answer to Paige's question, the CD symptoms all apply. People have varying experiences on that particular. That's all I have in my corner.
Okay, great. Any other questions? Okay, thank you.
Thank you.